Hello and welcome to South First. I'm Anusha Ravi Sood and you're watching State of Play, our daily roundup of all things politics, policy, and human interest. When the entire country's gazes were fixed on what was happening between India and Pakistan, the cross-border strikes between the two countries in the aftermath of Operation Sindoor, the government of India very quietly released startling data. How many people did really die due to the COVID-19 pandemic in India? This data reveals that there may have been severe, massive underreporting of COVID-19 deaths. The number will shock you. In the year 2021, the country reported excess deaths of 2 million, which means compared to previous years, India saw an increase in more than 20 lakh deaths in 2021. Several of these deaths were never attributed to COVID-19 because the government's official numbers on COVID-19 deaths in India is a fraction of this 2 million excess deaths that were reported in 2021 alone. Nearly 2 million people, that's nearly 20 lakh people lost their life in India, counted as excess deaths. This is an increase of more than 26% from the previous year of 2020. But do you know what India's official COVID-19 casualty number till as recently as May 2025 is? It is just 5,33,665. This figure clearly is barely a fraction of what seems to have been massive excess deaths in India in 2021 after COVID-19 pandemic hit just in the year of 2021. Now you may ask, where did I get this data from? Well, like all media houses, especially Times of India that reported this quiet release of data first, this comes directly from the government of India. It is a report on medical certification of cause of deaths of 2021, the government of India's own data. This comes from the civil registration system, which perhaps is the first official data on the actual number of deaths in 2021, which gives us an idea of how many Indians lost their lives in a pandemic year and how these deaths perhaps were severely underreported as being COVID-19 deaths. The official number of government of India as far as COVID-19 deaths are concerned make up barely 5.2% of this entire 2 million excess deaths that is now being reported thanks to this newly released data. Well, you could ask me, how am I inferring that these excess deaths, 2 million excess deaths, are an indication of underreporting of COVID-19 casualties? Well, because India's annual death rate shows a rise of just about 1 to 2% from the previous year. This is due to changing demographics, rise in sicknesses, illnesses, changes in population numbers, accessibility of healthcare. All of these things put together probably will show you a difference of 1 to 2% between 2 years as far as death numbers go. But significant jumps or significant rise in death in any country compared to the previous year can only mean one thing: a catastrophic event like a pandemic. Compared to 2020, India saw 26% increase in deaths in 2021. What it shows is that this is abnormal, this is atypical, which means there was a huge contributing factor like a pandemic, like a disaster. Take this for reference. Between 2007 and 2019, the average annual deaths in India figured between the range of 8.1 million to 8.6 million, and the mean of this entire period is about 8.35 million, that is 83.5 lakh deaths per year. However, this new data put out by the government of India shows 2 million excess deaths. Now, this number is over and above the average deaths we have been seeing year on year in India since 2007. Let's remember that in 2022, in the middle of the pandemic, the World Health Organization gave out startling numbers of what the actual COVID-19 casualty data was like from India. The World Health Organization estimated that in 2020 and 2021, India had seen about 47 lakh COVID-19 related deaths. This estimate is almost 10 times India's official attribution of COVID-19 deaths, which were just about 4.8 lakh for those 2 years, 2020 and 2021. Given that this new data shows just in the year 2021 there were 20 lakh excess deaths, it begs the question, was there massive underreporting of COVID-19 deaths? Was there a deliberate attempt to distort data? Did we actually lose out on the realistic assessment the impact of COVID-19 had on India and Indians, our lives and livelihoods? That is the big question this data begs. This, in fact, is what cover-ups are made of. The new data from Government of India shows that there are several states that perhaps have indulged in severe underreporting of COVID-19 cases in the year 2021, contributing to this huge number of 20 lakh excess deaths. Among the larger states in India, Madhya Pradesh, Gujarat, Uttar Pradesh showed massive underreporting of deaths in 2021. Take these numbers or consider these numbers. Madhya Pradesh in 2021 saw an increase of 1,78,000 deaths. Only 10,788 deaths were attributed to COVID-19 from these numbers. Similarly, in Uttar Pradesh in 2021, there were 4,78,682 additional deaths. However, of this entire number, only 23,743 deaths were attributed to COVID-19. Even among southern states, with the sole exception of Kerala that has shown great transparency in reporting excess deaths in 2021, all other states seem to be following the same pattern of Uttar Pradesh, Gujarat and Madhya Pradesh. Kerala too, like much of India, saw a significant increase in number of deaths in 2021 in the middle of the pandemic and recorded 3,38,648 deaths. This was a staggering 35% increase from Kerala's annual regular rise or average deaths reported in the state. Out of this 3,38,648 deaths that Kerala registered in 2021, about 72,139 were attributed to COVID-19. Now compare these numbers. A small state like Kerala had recorded over 72,000 COVID-19 deaths in 2021. But big states, large states like Uttar Pradesh claimed only 23,000 people in that state died of COVID-19, and Madhya Pradesh claimed just about 10,000 people had died due to COVID in 2021. These states are far bigger, larger, and have much more population than Kerala. Was the gap then in transparency and underreporting of COVID-19 cases is the question. In the same year, Karnataka registered total deaths of 6,66,402, accounting for an increase of 20.8% over 2020 numbers. But of this number, only 40,411 deaths were officially attributed to COVID-19. Tamil Nadu also followed a similar pattern. The state had recorded 8,75,012 deaths in 2021, an increase of 27.3% over 2020 death numbers. However, only 38,086 deaths were officially connected or officially attributed and recorded as being caused by COVID-19. In Andhra Pradesh, the official death registration in 2021 was 5,56,102, an increase of 22% from its previous year of 2020. But out of this number, only 14,733 cases were attributed to COVID-19. Telangana, of all the southern states, stood out for what seems to be severe underreporting. It had perhaps the lowest attribution of deaths in 2021 to COVID-19. The state reported 234,425 deaths in 2021, a 15% increase from its previous 2020 numbers. However, Only 4,111 of these deaths were attributed to COVID 19. Nobody can forget the horrors of COVID 19. Can you or I ever forget the heartbreaking visuals of dead bodies floating in the Ganga? Or, for that matter, the mass burial sites across the country? Can anybody forget the dozens of ambulances standing in a queue outside crematoriums and graveyards, waiting for their turn to bid adieu to victims of COVID 19, even as grieving family members stood in PPE kits? The trauma that the pandemic has inflicted on all of us is unforgettable. The clear indication that there was massive underreporting of COVID 19 deaths in India shows not just a lack of respect for those who lost their lives in the pandemic, but also the inability to assure family members who lost their loved ones that the person who died due to COVID 19 mattered. This massive probable underreporting shows that India never told its citizens the actual magnitude of the damage COVID 19 had caused to all of us. It also means that we really will never be able to assess the extent of damage that this had on all of us. The bigger question is, why did the Indian government keep these numbers under wraps? Why did it take the Indian government 4 years to make this data public? Indian citizens deserve to know what caused this massive spike in deaths in 2021. Indian citizens should now seek accountability on two fronts. One, why was this data kept under wraps for 4 years? Did citizens of India not deserve to know the full extent of damage that COVID 19 caused all of us, especially when we lost our loved ones, dear and near ones? We deserved to have this closure. The second and more important component is, was this an indication of excessive, massive underreporting of COVID 19 deaths in India? Who was responsible for it, and why were these deaths not reported in time? Until next episode of State of Play, where I bring to you more from the South and the nation, do stay tuned to South First. Thank you so much for watching.